Nutrition. What is a balanced diet today? Haro on red meat, on salt, sugar and fat. At a time when food condemnations are raining down, what remains of the nutritional balance? Let your food be your medicine. This formula, attributed to Hippocrates, tutelary figure of medicine, has been used in all sauces, including those of the most absurd diet. But its success is undeniable because it reaffirms a popular belief. You have to eat well to be in good shape. And it is not the nutritional surveys repeated over several decades that will contradict this impressio. In 2017, during the third edition of the vast Inca study, National Individual Study of Food Consumption, the National Food Safety Agency, Anses, concluded that the role of food in increasing or the prevention of certain diseases such as cancer, obesity or cardiovascular disease is now scientifically established. Junk food kill. Too much salt, sugar and fat. Too many ultra-processed foods. Not enough fiber, fruit and vegetables. The diagnosis is made. In our countries, it is no longer undernourishment, but dietary imbalance that kill. It is not enough to eat, you have to eat everything. Last April, an international study published in the journal The Lancet quantified the number of deaths worldwide attributable to poor diets at 11 million. That is 1 in 5 premature deaths, more than tobacco, which causes 8 million deaths each year. Eating balanced is not necessarily a concept that goes without saying. Is the food balance identical for the Chinese and the Italian? For the teenager and the old man? For athletes and diabetics? The cardiologist advises balancing your diet with more oily fish. The gastroenterologist recalls the interest of fibers, and the pediatrician that of dairy product. The geriatrician, finally, checks that the elderly person consumes enough protein. However, there are no contradictions between these specialists because in the end, the personalized advice of each doctor to his patient fits well into a nutritional PLA, which lays down the conditions for a balanced diet in terms of public health. A halt to the progression of obesity. And in fact, the National Health Nutrition Program, PNNS, was able to make people smile in 2001 with its invitations to eat 5 fruits and vegetables, but it did have a positive effect. In 2016, the Esteban study showed that, over 10 years, there had been a halt to the progression of obesity and overweight in adults and children alike. In France, public health campaigns participated in it, notes Dr. Chantal Julia, doctor, teacher researcher at a PHP and Paris 13 University. In January 2019, to take into account advances in research, the French Public Health Agency therefore changed the recommendations of the Eat Move program with some new features. Consume more legumes, chickpeas or lentils, for example. Increase the share of whole grain starches, such as whole grain bread or rice. Add nuts, almonds, walnuts, hazelnuts, rich in omega-3 and beneficial at the cardiovascular level. Limit the consumption of deli meats and meat. Varied fruits and vegetables remain among the recommendations of the PNNS 2019, as does the call to further reduce the quantities of sugar or sal. Do not calculate everything. Nutritional balance should not be considered from the strict angle of a balance between inputs and outputs, consumption and expenditure of nutrients, but as a global food plan favorable to health, explains D. Julie. A vision function of food, limited to calculations of intake of such a nutrient or such a vitamin, cannot be integrated durably into daily life, and it risks on the other hand to favor orthorexia, an obsession with food control of which we know perverse effect. It is also for this reason that the advice of the PNNS must be understood on a weekly basis rather than on a day-to-day basis, even less meal by Maya, and that they also insist on the importance of exercise to fight against a sedentary lifestyle. Eating balanced is not filling out a balance sheet, but neither is it demonizing certain foods and banishing them forever. It's more about showcasing good products and promoting merit. This is the objective of Nutri-Score, the nutritional labeling launched by Public Health France in 2016. Its logos, which indicate the nutritional value of a food product based on a classification from A to E on a colored band from green to red, are intended to guide consumer choice. Ultra-processed products labeled E are not prohibited, but brought to the attention of the customer, who can thus limit their consumptio. In addition, all processed products in the same category, pizzas or industrial biscuits, for example, do not all end up with the same E on a red background, notes Anne-Juliette Seri, head of the Nutrition and Activity Uni, Physics at Public Health Frank. Biscuits with less fat, for example, or less rich in hidden salts, have a C rather than an E, and the consumer finds his bearings immediately without having to consult the nutritional information, which is always written in lowercase character. Indirectly, the Nutri-Score is also designed to encourage manufacturers to improve their recipes and get their products out of the red, confirms Anne-Juliette Sir. Finally, eating a balanced diet now also means eating ethically. Since the environment and health are inextricably linked, the public health researchers who are developing the PNNS therefore assume that they now also want to influence the improvement of foodstuffs by recommending short circuits, seasonal and even organic products, and by limiting pesticide